Welcome to From the Hill. This is State Representative Jim Arciero doing my Zoom version through the pandemic. Each and every week, I like to provide the people of the 2nd Middlesex District with resources, information, and individuals that are on the front lines that are helping to keep our families safe and protecting people. And today, I'm very pleased to have two guests that I've worked with for over a decade, representing the area of Westford. I have Westford Police Chief Tom McEnaney and Westford Fire Chief Joe Targ. Thank you for coming on, gentlemen.
Thank you for having us.
I appreciate it. We're probably looking at about week 7 or so since the stay-home order has happened. I think we were talking before the show to the chiefs that some of these days seem to be just blurring into one another. It's certainly been difficult challenge for all of us, with our families at home, etc. But first, for you folks, I know that you come from a long line of public servants. You certainly have dedicated your life to public service and the fire department and as first responders in the police department, and you have family that are first responders. So how's everybody doing? How's the families?
Joe, do you want to go first?
I can. Everybody in my group, my family is doing good. We're really getting used to everybody else is staying home, but we're going to work every day. It's kind of interesting to leave your family, the kids and the spouses and stuff, and driving to work on the empty roads. It's definitely quite interesting coming in, but everybody seems to be doing good.
Well, that's good. God bless you.
So with me, Jim, it's kind of a unique situation where everybody's healthy, thank goodness, but I have 9 in my household.
Wow.
So we're almost at the limit at 10, and we have another grandchild on the way very soon.
Congratulations.
So I'll hit that limit. So I do have first responders in the family, and I have a daughter that works in a hospital setting. Two of my sons are police officers, and myself being doing the job that we do. So it's kind of a different circumstance. We're going to work every day, and we are concerned with, we just have to take the proper precautions and make sure that we're doing what we can to stay safe so we don't get the families sick as well. So that is a challenge, and I know it is for all public safety to take those steps and make sure that we're doing. But we are interacting with the public on a daily basis. We try not to, and I know the fire paramedics and fire department are in the same boat as our police officers. We still answer those calls for service, and the business for police and fire have not changed. The service has changed a little bit. We now are taking some reports over the phones when we can do that. So it has been a challenge, and for all of us to kind of get our arms wrapped around them.
Yeah, you remember right around the time, well, first and foremost, you would say that from the governors to the President of the United States to governors, U.S. senators, the House, legislators, first responders, chiefs, people on the front lines, information changes so rapidly and
yes.
so quickly. And if you recall, right around the time that the pandemic was starting to hit Massachusetts, I think Middlesex County still has one of the highest numbers. We're the biggest county. There was obviously a national shortage of medical equipment, ventilators, PPEs, and Westford was no different.
That's right.
I remember having those conversations with both you gentlemen and having conversations with the town manager. How are we doing right now with PPEs for our guys on the front lines?
Well, I can say that we're actually doing pretty good. Initially, we weren't really in, I would say, great short supply for normal operations, but when we had this coming, we just didn't really know what to expect. And it was really, really tough, even though we had some on hand, we know we were going to need more, and it was truly a struggle to get the equipment, even N95s or gowns, and we got it from reaching out several different avenues. We had a facilities, Paul Fox, who joined our staff this year, was instrumental in helping us out, but we also received equipment from MEMA, donations from people dropping stuff off, masks, gowns. Northeast Region 3, our medical region. They came through, they had an order, and they were able to help the towns, cities and towns in their region, which was huge for us. Right now, we're pretty well stocked up, but it's one of those things you don't want to take your foot off the pedal with what's going on here. Who knows how long we're going to be dealing with this and how bad it's going to get. So we really want to keep our ordering and avenues and trying to get equipment, and we're seeking out any way we can. It's just we've seen some places where they've definitely increased the price on this equipment, and it makes it tough. So we really try to go with the MEMA and the Northeast region medical to get this equipment instead of reaching out to private vendors right now. But we do have to solicit some quotes from them, and I think we're seeing a little slight increase, but they're not out of reason for some of the ones we're buying from right now. So we're doing all right.
Now, Chief,
So,
go ahead.
yeah, Jim, if I could just kind of kick in on that, as far as the PPE goes, when this first all started, we had very limited supplies to deal with. Almost the necessary supplies that we deal with a routine situation. But this is anything but routine, so it's a fluid situation. And when the necessity for additional PPE came out, we worked very closely, and I'm going to shout out some people. Jim, your office has been great to us when we reached out to you, so thank you very much. We appreciate that. And Joe Targ, the fire chief, is also our emergency management director with Tim Wickham, and they took a lead with dealing with MEMA on that. Jeff Stevens, our healthcare director, in trying to get us equipment that we need. Again, he was very instrumental in that. The town manager's office, Sam Gray, reached out to local vendors in our area, and donations came in immediately, and we immediately put that stuff to work. The schools really helped out in getting us some of the equipment that we needed, because we were disinfecting almost every day, and again, like Joe Targ was instrumental in getting us some equipment to help disinfect the cruises on an everyday basis. So we've kind of leveled off with that. Like the chief had said, we are not taking our foot off the pedal on this, and this is something that we're in an after action report, we will kind of identify as a key component on getting a necessary stockpile so we don't run into this situation again. We had, like I said, Transmed Pharmaceuticals dropped off and donated PPE gowns for both police and fire. We couldn't get our hands on that at the initial stages. So we were very thankful to that. Ideal Block dropped off disinfectant. Very difficult to get our hands on disinfectant. So we are very thankful for our community's response. And St. Catherine's, they had hundreds of masks that they had set aside for their mission trip. The kids that were on the mission trip, they donated the masks to both police, fire, and the hospital. So the community has come together and has been very, very supportive. And if we need something, the town's there. We try very hard to get it for our first responders. So we've been very fortunate in that regards.
Now, we've seen a new reality. People ask me all the time, when do you think there'll be a vaccine, or when do things stop? And, from this stay-at-home order, from social distancing, from the CDC guidelines, from PPEs, and certainly we're going to have to, cautiously try to start this neo-normal in phases, whether it's businesses, whether it's, people trying to go about their regular lives. Now, my question to you guys, and I'm sure you've seen a lot of different sort of changes with people's behavior as well. Has that changed in terms of calls that aren't necessarily directly or indirectly COVID related, like stress issues, domestic violence, issues relating to anxiety from being inside so long? Have you seen that at all, Chief McEnaney?
Yes, we have. We've seen it's with the stay-at-home order, we have a little bit of cabin fever going on. Our domestics We still are handling those domestic calls. The anxiety level with the public, the general public, is up. The new orders that are coming out from the state regarding wearing a mask, and I think it's Order 31 from the governor's office, that has generated some response, but we do see the impact that this pandemic is having. Our routine calls that we are generally dealing with, our proactive calls, such as motor vehicle stops, are down because people are staying at home.
Mm-hmm.
So we're doing less interaction with motor vehicle stops. So those numbers are going down, but we still have that presence of those calls for service from the general public. Those are remaining pretty constant. But the proactive stuff that the officers are doing, the motor vehicle stops, those are going down. Accidents are going down. But again, the anxiety levels, and Joe can speak to this as well, we're still doing those ambulance trips and those calls for people that are in crisis.
Mm-hmm.
And Joe, if you could kick in on that.
Yeah, I can say that the fire calls are about the same. If people have smoke detectors going off the house or fire, they're still going to call. We've seen a decrease in ambulance calls for March and April, probably about 20 to 25 each month. We're off on an average. We're finding even like going to urgent care or medicine, they're not going to the emergency rooms. They want to stay out of them, is what we're finding. So we're not getting the calls. The calls we are getting are more severe calls. We've had since March 1st, we've had 36 confirmed, actually suspected cases that we've transported of COVID, and 22 that were confirmed. And usually they, like the report says from the state, they do have underlying conditions. They have other things going on. They have chest pain. They have difficulty breathing. And that's putting a strain on our guys. Even though we have less calls, they're taking longer. They have to gown up. We're running basically 2 ambulances now. We're running at full staff. 2 ambulances, the second ambulance is cross-staffed with the ladder truck. But there's paramedics on each unit just to keep our gear down the amount of stuff that we use, PPE we use. So these calls take longer. We used to go with 2 paramedics or 2 EMTs to the hospital. We're now going with 3. We're finding these calls are very severe that we need 2 in the back working with them. And then we have the back-to-back calls. And so when we have something like that, that leaves 6 people out of town, and we're really 4 left in the town protecting the town. So it is putting a strain on service. Luckily, we have, where we're at in the budget right now, we're in a good spot personnel-wise that we can keep that full staff till the end of the year. At least unless something really happens that's unforeseen, where people really had to go out for a couple of weeks because they have to self-quarantine.
Now, a quick question on that. Overall, Chief Targ, was in Littleton this past, but still go, there's certainly a lot of work that went into dealing with the outbreak at Neshoba Valley Nursing Home in Littleton, Life Care Center in Littleton. Certainly a lot of those places with, folks that have underlying health issues or are recovering from a health issue, are more susceptible to the COVID-19 virus. And there was certainly some issues with that particular Life Care Center. How has the calls been in Westford and any of the sort of, Westford House, nursing homes, et cetera? Because they haven't been the uptick as Littleton and Chelmsford in particular.
They've actually been doing pretty good. We do have, I believe we've had 44 confirmed cases between the long-term care facilities we have with Bridges. We have a couple of group homes, and we have Westford Nursing on Park Drive. And Park Drive seems to have a pretty good handle on it. We gotta say, I haven't gone in there. I'm relying on my EMS directors who have been going in there on calls. They tell me they seem like they have them in quarantine. They have them separated. They're really doing due diligence to keep everybody else safe in the facility. So that's what I've seen from my EMS directors.
Yeah, no, that's good to hear. Certainly they become, some of the analogies we've used is infected cruise ships, where you have
Right.
at Wilton House, you have almost 90-something% of the individuals there are either COVID positive or recovering. These hot spots that have popped up all over the state. Now Governor Baker has invested $133 million into providing additional testing for employees as well. There was a reluctance to test employees early on during the pandemic's outbreak, probably about 6.5 weeks ago. And that was the challenge that the first responders in Littleton were dealing with. And we all worked together as a great team, and the National Guard did get everybody at the Life Care Center tested, and they've expanded that program now. And that's positive news, but certainly there was a lot of fear of a lack of oversight with the Department of Public Health and to mandate that everybody test. But I think another piece to that too is the fact that information is changing so quickly. If you remember the first press conference that Governor Baker had, he's talking about, look, if you have symptoms, you have a sore throat, you feel sick, call your primary, don't crowd the hospitals. But now we're learning that you can be asymptomatic and be a carrier and have it. And, God forbid, put someone else's health or life at risk. So information also changes so quickly, and I think we just have to be diligent to be up with every code and facts and things that are moving forward. And that's why I think this show and so many of these things are so important, because we have to continually make sure that the public is informed on what the changes are. Now, for instance, Chief McEnaney, I was just curious this myself, since some of these orders had happened. I mean, I get it at my office. I get people, why aren't the golf courses open? I had somebody scream at me the other day about that. Obviously worried about the duration of time that we're going to be having a stay-at-home order. Have you noticed, for instance, Tuesday was the mask order? Yep. Do you anticipate anyone in Westford being sort of refuseniks to that in public?
So we did receive a call that somebody refused to wear a mask yesterday, and they were picketing at one of the local stores down there. And we did, by the time we got down there, the situation was kind of rectified. But, we're taking the approach with the mask order that it's more education before enforcement. If we can educate people about wearing a mask and why it's important to wear a mask, and that's our primary. The enforcement part of this is coming from the Board of Health. They're the primary ones, but we can assist the Board of Health under that order with enforcement, but we're taking a stance that, it's more about education and getting somebody. If my officers were giving a directive that if they come across somebody and they don't have a mask, my officers are asked to carry an extra mask and provide the person with a mask instead of giving a citation. So we haven't come across the person that's really going to say, no, I don't want your mask, and give me the citation. Or this is just so new. We haven't come across that, and I hope we don't. And I hope we don't, and I hope that people understand that we're just all trying to get through this pandemic, and everybody is pulling in the same direction. We want to have this thing put aside so we can resume our normal lives. And so I think if everybody has a little bit of patience, and we'll get through this, but it is challenging, Jim. It really is.
Yeah, about 7 weeks ago, I know that I had talked to both you gentlemen about legislation I filed for first responders. Essentially what it would do is, if, God forbid, a police or fire or first responder had contracted COVID, that we ensured that their benefits, their sick time, their vacation times wouldn't be exhausted if they had to quarantine or self-quarantine or hospitalized. This is legislation that has momentum. I have about 50 co-sponsors, both sides of the aisle, both branches. It's in committee right now, moving forward. And first, I just want to thank you, for both of you, for your support for that. It's the right thing to do for folks that are on the front lines, keeping our neighborhood safe, protecting people. But also it's something that, is very important to get done as soon as we can. And yesterday we had our historic remote legislative session yesterday, which was interesting. We did it. We broke it up into groups of the 160 members of the House, and we had a monitor, and we watched from our laptop session, and there were scattered members of the legislature there in session, and placed our votes through phone calls. But I'm going to continue to push for this bill. Again, it has great momentum, and I guess I just wanted to ask you quickly. I don't know if you're able to talk about this kind of thing, but I was just curious: has anyone in any of your departments contracted COVID-19? Are you allowed to talk about that? And I guess just what's the status?
I don't think I would go as far as saying that they contracted it. I don't want to go that far down, but I will say that this situation has affected my officers. And Joe, could you, I think that's safe to say without stepping over any lines, it's definitely affected some of the officers and how we have to deal with that. And we're trying to deal with that as well. So I personally support that bill. And I think, I think that would benefit and clear up some of the issues and questions that we do have now and we may have in the future. We don't know when this is going to end. And I do believe that, this will assist us in giving us some kind of direction on how to move forward with somebody that contracts it or is affected by it, as you said.
And I think it is, it's certainly any first responder, any department in 351 cities and towns, you're the first ones on the scene. You're the first people there to help to protect people. You're the first people that could contract COVID-19. And that's why the legislation is important, and that's why we need to protect our first responders' benefits and their families. So I want to thank both of you gentlemen for coming in today. We've had a great partnership over the years. We worked as a great team. Your work does not go unnoticed. So many people depend upon the safety that you provide, protecting our neighborhoods, protecting people and their livelihoods. And I really want to thank you for coming on today. Each and every week I try to let my constituents and the public know a little bit about what's happening in the town of Westford and Littleton and Chelmsford. And each week I've been showcasing first responders so far. I had Littleton on last week, and this week I really appreciate you guys coming on.
Thanks for having us, Jim, and please keep us posted on any of those bills that are rolling out. And we appreciate all the help that you've given us in our community, because it is valuable when we can just pick up the phone and you can make a call and make things happen. It does really help us out. Well, thank you, Chief McEnaney, for your words, for your help, for your resources today. Thank you to Chief Targ for being here as well. I appreciate all of your work and both of your gentlemen's department's work. Thank you. We appreciate your help, Jim, for sure. Even the guys, they've been following this along the bill, and they really appreciate the work you've done with this. Thank you, gentlemen. And it's about that time. We have another From the Hill Zoom program in the books. Every Friday, each and every Thursday or Friday. It's been fluctuating a little bit. I like to have individuals on the front lines come in and speak a little bit about what they're seeing, their perspective on this pandemic, and resources to help constituents in the 2nd Middlesex District and beyond. So I appreciate everybody tuning in today, and I look forward to seeing you next time.